Marhaba, my name is Hijazi and I will be presenting our study, Public Health Stigma Towards Substance Use. If you're wondering what I said in the beginning of the video, it was hello in Arabic, commonly used in Lebanon and surrounding countries. The reason I greeted you in Arabic is because our project is in the Arab American community. Before I describe the project, I will explain that the project is a collaboration between a large multi-service agency in metropolitan Detroit called ACCESS, or the Arab Community Center for Economic and Social Services, and Wayne State University. I am a Community Engagement Manager at ACCESS for a federally funded community coalition promoting prevention on substance use and a PI for this project. The other PI is Dr. Cynthia Arfken, a professor at Wayne State University, who has conducted extensive research on substance use in the Arab American community. We also have team members of Hala, Mallah, and Ahmad Ballout, who we want to acknowledge. We cannot do this research without everyone on our wonderful team. Substance use is a problem in the Arab American communities, like all communities. The community traces their heritage to countries in the Middle East and North Africa. The countries share Arabic as the language and culture that emphasizes the group as opposed to individual. People from Iran, Afghanistan, and Pakistan are not Arabs, as they have different languages and different cultures. Similar to these cultures, substance use and misuse are stigmatized. The use and misuse can bring shame to an Arab American family. The community reinforces shame through public stigma towards those who use and misuse substances. The community is diverse, with people migrating at different times and different reasons. Major areas of settlement include Michigan, New York, and California. In Dr. Arfken's work, she documented the differences in willingness to discuss substance use in the community by people born here compared to immigrants, by gender, and by religion. By religion, we mean the two major religions in the Arab world, which is Christianity and Islam. In my prevention work, I have personally seen how people do not want to talk about substance use, or if they do, it is stigmatized those who do so. The stigma is a barrier to our coalition's prevention work. Locally, alcohol and drug overdose deaths are increasing among Arab Americans while declining among whites, emphasizing we need to expand our research. Our substance use advocate Ahmad Ballout works with our local police department to provide treatment options to care for individuals who have run-ins with the law. The goal of this program is to provide medical care for individuals with mental health and substance use. Ms. Mallah has an expert in health education who helps with prevention activities in schools. So what is our project? We want to develop a reliable and valid scale measuring public stigma towards substance use in the Arab American community. We then will use this scale to measure stigma, components of it, in the next phase of our project, hopefully measure its reduction from our prevention measures. We have established a diverse and national expert panel of Arab Americans at universities who are knowledgeable about research and substance use. The panel includes women and men, immigrants and U.S. born, and Christians and Muslims. Our local team reviewed the published literature of public stigma and modified its items to use for the Arab American community. We added a few items to reflect religious perspectives that were missing from the literature. An example of modified item is, in my community, most people would be willing to marry someone who has been treated for substance use. We then sent the 50 items to our panel for the review. We asked them if the domains were missing and how useful the items were for the community. The next step, reduced the numbers of items with positive scores to 19. Currently, we are conducting interviews in our community. We want to know if the items were understandable, and if so, their responses. We are using quota sampling to make sure that we have data by gender, religion, and nationality. With these data, we will refine the scale. With the new scale, we will survey the community to obtain internal consistency and independent sample and preliminary data and retest reliability. It was work in progress, and we thank our organizations for allowing us to present what we believe is important work to reduce stigma, promote prevention and outreach, and lower the burden of substance problems in the Arab American community. If you have any questions, please contact me, Mona Hijazi, at mhijazi@accesscommunity.org, or Dr. Cynthia Arfken at cynthia.arfken@wayne.edu. Thank you.